This week on the Wheelhouse. Funding our future. What state officials and industry experts are saying about childcare. For Connecticut Public, I'm Frankie Graziano. This is the Wheelhouse. It's a show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. This hour, help is on the way for Connecticut families. At a time when many are struggling to make ends meet, there's good news about the cost of childcare. State lawmakers last legislative session approved a proposal that funds free childcare for some families. They also agreed to cap the cost of care for all families in the state. We're going to get into that and meet the architect of this endowment. Beth Bye is the commissioner of the Connecticut Office of Early Childhood. Hello and welcome to the Wheelhouse.
Hello, happy to be here, Frankie.
Thank you so much for coming on. You are on your way out of a job, retiring effective October 1st. So we're going to consider this an exit interview of sorts.
You got it.
Your retirement will mark the end of 2 decades of service to the people of Connecticut, at least in a lawmaking capacity. But it won't be the last time that you work, nor work with kids. What are you up to next?
Well, what I'm up to next is I'm really hoping to work with families and children that are in healthcare settings and need support. More get back to the children and families and work directly in the next phase of my career.
And this entails, or at least involves, you getting a master's in social work.
In order to work in healthcare settings, you really need an MSW. It's a reimbursable license, if you will. So I've started back in school at the Erickson Institute in Chicago, getting my master's in social work with a focus on infant and early childhood mental health.
What are you willing to share, or what can you share about what the actual job will be once you finish off with the Erickson?
Well, I think part of doing an MSW program is doing internships and figuring out what fits. I know that in the short term, immediately I'll start volunteering, hopefully at the Village for Families and Children. They have some integrated healthcare settings, and they have a special preschool, just to get a feel for the work as a social worker.
Working at the Office of Early Childhood in the pandemic effectively made you a shepherd. So you're taking local kids from COVID to kindergarten at a time of shifting environments, evolving guidelines. How did the department rise to meet this challenge?
Well, it really was a challenge, and I think it was a time, it's hard to remember now, but it was a time when you were looking at morgues and parking lots at hospitals, and people were home seeing that on TV, and early childhood educators were still needed because doctors and nurses needed early childhood in order to go to work. They needed childcare, and the governor called and said, we need to find a way to do this. And so I think the field rose to the challenge. We found 26 programs willing to open in the peak of the pandemic to take care of doctors and nurses' kids. Those teachers, went out when things were very uncertain and did that. And the team at OEC just worked round the clock, working to get those open and make sure they were high quality and safe. And the governor really gave us clear direction about this we have to do. And we worked with the Dalio Foundation that got us $3 million in a week so that we could get those programs up and running. And we had a wonderful conversation with them at the end of the programs. They were really pleased that we were able to support the healthcare workers through that difficult time. So then still we had to come out of the pandemic, and other programs opened one by one with evolving guidelines from us. We were constantly working with the CDC, with the state health department.
You're writing a lot of those guidelines.
We were for the Connecticut child care programs, and some states closed all the child care centers. Governor Lamont never did that. Programs decided on their own whether to open or close. And then what he did and the National Guard did is we just got all those items out to the program so they could have the PPE that they needed to be safe. And literally the National Guard, we had 3 to 4 locations across the state, and child care providers came over the weekend and picked up supplies. And so though they opened as they could and as they felt comfortable and as they could staff. But it was quite a time. And I think that really changed the public's perception of early childhood and child care in Connecticut, where we realized, wow, our state can't run without child care. And I think that's what's led to this great investment this past year with the Early Childhood Endowment, really recognizing it is infrastructure, just like roads are infrastructure. People need child care to get to work. They need roads to get to work.
Is that a part of where we are now? We were just talking about 2020, 21, 22. Now we're in 2025. And the concern that you're always going to have now with children is, following the pandemic, where's their mental health? How are they doing, number one? And then number two, what happens if this happens again? Do we have a plan in place? So tell us about the current structure and where we're at now, and how do you think things are going?
Yeah, I mean, I think there are significant impacts from the pandemic on children and families. And when I talk to kindergarten teachers and first grade teachers, they're feeling some of those impacts because kids rely on structure and routine, and a pandemic is by definition pandemonium, and families need structure and routine. So everyone was thrown off their structure and routine for a long period of time. So it's taken time to build that trust in what's coming next among children, and I think we're seeing significant increases in children with emotional issues when they get to school, or even, you know, the infants and toddlers who were infants and toddlers during the pandemic are now sometimes some of our older preschoolers. So it's taken time, and I think some extra attention on the mental health issues. People don't think of infant mental health or toddler mental health, but it's a real thing. That's when children are learning to regulate their emotions.
This year's legislative session can be remembered for lawmakers committing to child care over the long haul. Eventually, Commissioner, every child in Connecticut will get free child care, or at the very least, the cost will be drastically reduced. As you leave, what are you doing to make sure that this kind of universal child care will endure in Connecticut? And why is it important for kids and their parents?
Well, we're really lucky to have people in place who are really committed to this, beginning with Governor Lamont, whose idea it was, and he's committed to this endowment and growing, as well as we had people like Representative Farrar and Senator Marr, who are champions who are going to be up there making sure that the investment continues, and then Elena Trueworthy, who will be in my position, is just fantastic, and I think OEC's job is to make sure they're implementing it in the way that it maximizes a benefit to children and families, to child care workers, and to the state of Connecticut's economy. So they have that heavy responsibility of implementing this in a way that really works for families.
You give Governor Ned Lamont a ton of credit for what's been done to support kids and their families in recent years, as you can hear already in this interview. Others, including Lamont, give you a ton of credit. Since 2007, you've rather systemically, I don't know what the word is here, helped put Connecticut on course to have early childhood infrastructure. Besides a master's degree in child development and 45 years of experience in the field, what does it take to do this work?
Well, I think it starts with a passion and an understanding that young children do need particular attention and focus, and having the Office of Early Childhood where we're just focused there, because when you focus on young children, you focus on families equally. And sometimes in schools, I think we separate parents and children. In early childhood, they're one and the same. So we know that as we're supporting children, we're also supporting families, and we need to support them because they're still learning to be parents, right? I think we're all still learning. I have 30-year-olds. So those early years are super important. And for me, it's been really a collaborative effort. I've been an advocate since my daughter was 1 year old on my back in Stamford, working for worthy wages for childcare workers. And I look back on that time, and I think that's when this began, to say we need to say this work is important, this work matters, that young children matter, that as a culture we need to pay more attention to them. And I think the advocacy community has been incredible. Philanthropy over the past few years has really funded advocacy. There's so many legislators and numerous governors who've thought this was important. And you know, Connecticut's really seen now as one of the top states in the country for helping families with young children because of this long work. But it's really community organizing is what it comes down to, is all people coming together and saying this is a priority, because there are so many priorities as a state.
What advice do you have for Elena Trueworthy, Governor Lamont obviously tapping her to succeed you.
Well, I think Elena is going to continue to use her superpower, which is listening. You know, we read what's happening in other states. We think about what children and families need. We put out plans like we did with the Blue Ribbon Panel plan, but we edited that plan about 20 times. And, you know, Elena was behind the launching of the parent cabinet, so in her blood is that families are just as important as young children. So I have no doubt that Elena will continue to listen and adapt and lead the agency in a way that will keep us tops in the nation.
Trueworthy takes over the Office of Early Childhood in an interim capacity in October. She won't officially have the job until confirmed by the state legislature next session. What will it take for Trueworthy? You talked about her superpower of listening, but anybody really in state government to work in a time where the federal government wants to cut education dollars? Do you think the United States government, as currently constituted, values child development?
Well, I will say that early childhood has pretty much been flat funded and not cut, whereas this administration is, you know, cutting critical human services for families that are going to impact their quality of life in a negative way. Child care has been held steady so far. I think it's pretty much a bipartisan issue that parents need child care to get to work, and early childhood pays off in the long run. The hard part is getting the investment. You know, the Biden administration had significant investments in early childhood. We had increases every year. Now we're flat funded. But, you know, I think what we've done with the endowment is we've said no matter what happens in the federal government, the state of Connecticut is going to take care of its own, and we're going to build a lasting savings account so we aren't subject to the whims of the federal budget going up and down.
And that, again, involves free child care for many to access that endowment, or at least capping the cost at 7% of household income for many other families. Is there anything in this job that you didn't get done that you wanted to do in your time in OEC, even when you worked with the state legislature as first a representative and then a state senator? Do you have any, regrets?
I don't think I have regrets. I think I'm excited. I mean, I think it's important for people to understand that in 2027 is when a lot of this will begin and the expansion will begin, and the legislature and the governor need to continue to put the money from the surplus into the fund to grow. I would say I wish that our universal home visiting initiative was further along. We're in Norwich and Bridgeport, reaching every new baby born, giving parents information. Talk about a return.
That's a lot. Can you tell me a little bit more about that?
Sure. We used some of the ARPA dollars, and then there were dollars appropriated this year in the legislature and in the governor's budget to have new babies get a visit from a nurse starting when the baby is born.
Every single
at
baby?
At the hospital. Every baby is offered. Born at Bridgeport Hospital and now in Norwich. I think that's Bacchus Hospital, if I have the name right.
Yeah.
We want the idea is to go statewide, and now the planning is to begin in New Haven. I wish this was further along and faster, because the impact on families to have those visits, the reduced emergency room visits, the reduced anxiety among new parents, the improved health outcomes for mothers, because we have a real disparity in maternal health outcomes. So it addresses so many issues.
And there's a widening desert for maternal health care as well.
Absolutely. So it gets a nurse out in every part of the state, and I think families are welcoming to nurses. So this is started with Deidre Gifford and also Vanessa Durante's back when she was commissioner, thinking, the governor said to us, what's one thing we could do that would make a really big difference with these funds? And we thought, start as early as possible. So I wish that was further along and, more part of the culture, because it's still going to be subject to, funding decisions and things like that. But I think what the governor has done for families with young children, now starting at birth, then you have baby bonds, now you have this child care expansion, is really incredible.
The earliest intervention. Wow, that is incredible. What about the LGBTQ plus community, Beth? You and your wife, Tracy, are pioneers, this first same-sex couple married here in Connecticut. Now the Supreme Court has been asked to do away with same-sex marriage as a constitutional right. I know that Supreme Court Justice Amy Coney Barrett was recently interviewed and asked about it. Trans people are being asked to identify in a way that's, I guess, inconsistent with their preference, if I'm trying to say that in a most careful way. Trans athletes are being banned from certain sports. How important is representation to you? How does one, you talk about advocacy, how does one advocate for the LGBTQ plus community at this time?
I think we need, just like we needed with the gay marriage movement, we need so many allies. We need people to speak up for us. We'll speak up for ourselves and we'll stand up for our rights, but we really need allies, and we need people to see us as human, as just people who want to love who they love and be who they are. I think for me, I've told the story multiple times, but I think of Connecticut and how far we've come and what representation means. I mean, when I was a director of a program more than 20 years ago, when we weren't anywhere near where we are with our LGBTQ rights, I could not continue to be a director in a religious organization because that's the way it was, which shifted me to a different job. And then I think 20 years later, the governor appoints me to be in charge of young children for the whole state. And there was barely a blip. No one said, oh, the governor appointed this gay woman to be in charge of our children. Oh, no. At least I didn't hear anything. It was almost like a non-issue. And to think how far we've come, we just can't go back. Tracy always said, you cannot take rights for granted. You have to stay after it. And I think we're poised in Connecticut to stand up for it. And we have, they're great national organizations sticking up for our rights, but we can't take them for granted. And as you see what's going on with immigrants and others being othered, I think as a culture we have to be really careful about seeing each human as human and not as some other than us, because, I think being a member of the LGBTQ community, I watch what's happening with immigrants, and I think, what's next? Is it us? Who's next? Once you've stood in Dachau and you've seen those triangles and the different colors, and it's a concentration camp in Germany, you realize that, first it was people with disabilities, then LGBTQ, then people who, all kinds of one after the other. And I think we need to pay attention and not get too comfortable, especially as other people are being so othered in this current time.
Those examples I brought up to you are examples where we have gone back, and that's why it's both intriguing and fascinating that I'm even asking these questions to you at this time, especially with quite the history that you have. But it certainly is illustrative of the time that we're in right now, which is why it's so important to talk to you. Your wife, Dr. Tracy Wilson, passed away earlier this year. You actually spent a lot of time, I don't know how many people know this, but with Tracy as she battled cancer, and then you have to juggle that big job that you have overseeing the state's child care infrastructure. I want to know, I'm being selfish here, what would Tracy say about your big career move right now? What would she say?
Well, she knew this was part of the plan, that I always wanted to get back to working with children and families in hospitals. And a lot of it had to do with her illness. I spent a lot of time in hospitals, and I saw what, a genuinely caring person that came into the room and listened. And I also know young children dealing with ill parents or sickness themselves. We're not always good at talking about that or listening. So I think if she hadn't been ill, I probably wouldn't be doing this exact thing. But I would be getting back to direct care with children and families. I've been a boss since I was 17, when I first was Camp Pollywog director at the Bellhaven Club in Greenwich. And I'm ready to just not be the boss and be, focused on the children and families directly, that direct micro-level care.
A soldier, if you will.
Exactly.
You have been serving the people of Connecticut for so long. Beth Bye, the outgoing commissioner of the Connecticut Office of Early Childhood, we wish you well in this retirement from state service, but also look forward to see how you continue to serve us here in Connecticut and our children. Thank you so much, Beth.
Thank you so much, Frankie. Have a great day.
After the break, more on the state child care endowment. What an interview that was, including information on when you can expect some help with your daycare bills. I'll be joined, as I am right now, by Georgia Goldburn and Michaela Savitt. Folks, are you working overtime just to afford childcare? Get on the phone and in the Wheelhouse, hit up 888-720-9677, 888-720-9677. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. This hour, we're talking about early child development and how state officials are fostering kids' future. We just spoke with one of them, retiring Connecticut Office of Early Childhood Commissioner Beth Bye. For some reaction to that interview and a deeper dive into child care legislation in Connecticut, I'm now joined by a reporter and a child care center director. Michaela Savitt is a Connecticut public state government reporter. Michaela, thanks so much for being on here today.
Thanks for having me, Frankie.
Good to see you. Good to have you back in studio. Georgia Goldburn, the executive director of Hope for New Haven Incorporated. That entity oversees the Hope Child Development Center. Georgia, thank you so much for coming on the show. Nice to see you again.
Thank you for having me. Good to see you again.
Folks, I want to know what your child care situation is. Can you afford it? Let us know how you're getting by in 2025. Get in the Wheelhouse, 888-720-9677, 888-720-9677. Georgia, we just spoke with outgoing Connecticut Office of Early Childhood Commissioner Beth Bye. What has her leadership meant for your industry and for the children in Connecticut?
I can honestly say that Beth Bye was the right commissioner at the right time. I think a lot of people may not know or may forget that Beth was also a legislator, and she was the co-chair for the Appropriations Committee. So she has done a lot of work, in the legislature. She has negotiated with the governor, and I think she brought that skill and that expertise to her role as a commissioner. And I think that was what was very instrumental in helping us to advance legislation that we're now seeing with the early childhood endowment. I think, Beth has a way of coercing without really you feeling coerced. And I'm pretty sure that she used those skills on the governor to move him. And anytime we spoke, because I do challenge Beth sometimes on some of the policies, and as is my role to do. She was always open to hearing those dissenting voices, and I think that was something that was instrumental to her success, being open to hearing where policies were not working well on the ground. And so I think, again, she brought a leadership style that engendered a lot of trust among her staff, and I think she was available. I think she has been so available as a commissioner that she doesn't feel so much as a commissioner, but more a peer and a colleague in this work. And I think that was instrumental in her success as a commissioner.
In the interview with Bye, I asked her to advise her successor about what the job as the early childhood commissioner brings. What advice do you have for her ultimate successor here, Elena Trueworthy?
Commissioner Trueworthy has deep roots in the early care community, and she has a lot of goodwill coming into this role. I think she has, lots of supporters in the field as well as, as a part of her team. My advice to her would be to be open to those dissenting voices. Lots of time Beth and I would, have conversations outside of, these arenas of public ideas. We would text each other or we'll call each other early in the morning, not so much late at night, but sometimes on the weekend to say, hey, here's where things aren't working. And she was open, Commissioner Bye was open to bringing in those dissenting voices and hearing some hard truth about an idea that you have worked so hard to put forth, and then to hear that it's not working the way that you thought it was going to work. She was always open to hearing that and bringing in those dissenting voices. And I think Commissioner Trueworthy would be well served to making sure that she doesn't exist in an echo chamber, and making sure that she's hearing from all the constituents and hearing the difficult truth as well about how policies are working.
And it's not just a few dissenting voices. It's not necessarily dissenting voices either. It's just, as I've seen some of these Zoom calls during the pandemic, there are thousands of stakeholders that are ultimately trying to get a voice and trying to reach the commissioner, trying to reach folks that are really big time here in Connecticut in terms of lobbying and advocacy, like yourself, Georgia. So, I mean, there's a lot of voices out there. So that is a big job. Yes. Michaela Savitt does a good job for Connecticut Public here. During this year's legislative session, which you covered, Beth Bye and her team celebrated a legislative win, if you will, that's been years in the making, Connecticut's early childhood education endowment. Let's break down some of the basics of the state child care endowment. Will this lower the cost of child care across the board, and how will Connecticut families benefit?
Yeah, so just taking a step back and talking about the endowment, just to remind folks that, it has been funded with this initial $300 million from our state surplus. And, this is a fund that has a whole advisory board with stakeholders, several lawmakers. And this is a fund that will continue to grow with annual funding from budget surpluses. And it will happen in phases. This is not something that can just be, the childcare crisis can't just be fixed overnight. So, in talking about will this lower the cost of care across the board, that's the goal for, certainly families that earn up to $100,000 a year and are enrolled in Early Start CT childcare would be free under that plan. And then under the plan, families earning more than $100,000 per year would pay a sliding scale fee capped at 7% of their income. So, compared to, Pew Research says, there's a big range of what people pay for childcare, but it's in the tens of thousands. It could be the cost of a new car, and people, in the lower class and middle class both report having struggles to pay for childcare. So, it's the goal to help make it more affordable, across the board in Connecticut. In terms of how Connecticut families will benefit, it's not a silver bullet approach. There's a lot of things that need to happen to expand the system, overhaul it, if you will. This stems from a workforce crisis. So, increasing the pay for childcare providers to be on par with kindergarten teachers, paying these providers what they're worth, and also, helping them pay for their health care costs is also part of this plan. So there's a lot of work to be done, and there's a lot of plans in motion to make it happen in the state.
2027, does that sound right to you, is when this will go into effect and when you might be seeing a change on your bill, so to speak?
Yeah, well, 2027 is when most of the changes are going to be happening, as outgoing Commissioner Bye said. But the work has already started. So, like I said, the $300 million has already been transferred into this fund. The state can draw down a certain percentage from that fund every year. So right now, they're doing a lot of community planning, making sure that parents and local governing partners and child care providers have a voice in what the needs are in each town. And then they've also been adding spaces to preschool spots. Already this fall, there were at least 500 preschool spots added with using dollars from the endowment in cities like Bridgeport and Groton, New London, Norwich. I could go on and on. Yeah. But it's a gradual rollout. But yes, a lot of these big sweeping changes, and talking about the free child care for people who make less than $100,000 and the subsidized capped child care costs for people making over $100,000, plus the increased wages. All of that is ideally set to go in motion by 2027.
Free child care for many families, Georgia, cap costs for others. If it bears out the way that you'd like to, what does this new legislation mean for families with kids at Hope Child Development Center?
So I want to give some context, because what I think is important for your audience to know is that Early Start is a new approach to, or just a new name to existing state funding. So these state funding already existed. They were called Early Head Start Wraparound. They were called Child Daycare Contract. They were called school readiness. So these funds, instead of having these multiple streams of funding, have now been wrapped all around the banner of Early Start. So these slots already exist and they're already operationalized. So at Hope Child Development Center, we are an Early Start provider. And what that means for our family, when we were funded the state has been giving out these slots for the past 2 to 3 years. And they have changed all of the existing funding into Early Start. So for my center, when we became funded 2 years ago, 50% of my families went from paying tuition of $400 and above to now 50%, actually 60% of my family pay less than $50 or less. About 25% of my families pay zero or between $20 and less than zero. So without the full operationalization of this fund, it's already helping parents. And parents can seek out those providers that already exist in the community to find access to care that significantly reduces their tuition. I can tell you from my parents' perspective, it's transformational. One of the things with childcare subsidies in the past, the way that state has helped families, it's focused on the most vulnerable families, as we should. And those were the families who were making 60% or less of state median income. Early Start now looks at every single family. And so every single parent in my center who wants access to Early Start, because you don't have to access it if you don't want it. I don't know why a parent wouldn't, but every single parent, regardless of their income, can access Early Start. And that's part of the transformation of the program.
What you're digging into is something that's become very complex in recent years, and I think this is very important for people at home. We're funding slots many times in childcare, and now there's sort of the nomenclature and the streams, like you said, are kind of combined into one. You have Early Start now, which is a big thing. We know that the cost of care can change. We know that the economy certainly can change. So I think what you're digging at is while this is very transformational for families, you still have to pay for the cost of childcare. You still have to pay for the slot, if you will. So it's not like right away everybody in Connecticut gets free childcare. So help me understand this. What does it mean for a center from that perspective? So now will you have enough money to take care of these kids? Or will you be like in a situation, I think this might be helpful for listeners at home. We talk about Medicaid reimbursement, right? We talk about sometimes hospitals being left to hold the bag or providers. Could this happen to a child care center under the new funding? Are you concerned about being left paying for it?
That is actually happening now, because the way that Early Start is structured is it's a part of a three-legged stool of Early Start funding, Care for Kids, and family fee. So Care for Kids as a program now has a waiting list that spans between 6 to 8 months. So if a parent comes into my center and they cannot access the Care for Kids program, a huge portion of my funding has been removed. With Early Start, the vision and the goal is to eliminate that three-legged stool. So it's Early Start funding and combination of parent fees, or no parent fee if that parent income is below $100,000. So if they do not set the reimbursement rate at the true cost of care, then what is happening now with some providers where they're only getting a third or 2/3 of the funding that they need to operate, it's going to be devastating because, again, in 2027, new rules take place. So every single provider will have to pay their staff people according to the OEC compensation scale. Many providers right now are not paying their educators at that level. So then if you are getting funding that doesn't really cover your true cost of operating, and then you have new mandates attached to that. You could find that the state has a wonderful story to tell about families having access to free care. Parents, of course, will benefit greatly. My parents now, without it being fully operationalized, are benefiting greatly. But providers could be left holding a bag that is could possibly put them in a worse situation, because we can't go back when everybody feels that we've solved childcare to say, hey, you haven't really solved it for us. So I think the pitfall for the endowment fund is making sure that it's sufficiently capitalized and making sure that the reimbursement rate for providers cover the true cost of care.
Michaela, what can you say about the next steps for the child care endowment? How will legislators and child care experts implement the new legislation, or at least talk about this in 2026?
Oh, in 2026. Well, they're talking about it right now,
Sure.
Frankie. They plan to release 1,000 additional spots with a request for proposals that is being released, I believe, late next month. And those early start slots, as Georgia described, will be available in the new year. And this is going to be a priority will go towards childcare deserts and high-need communities. In terms of next steps for the child care endowment, like I said, there is an advisory committee that is working on this, and there's also a lot of work being done on the ground, the listening sessions across the state. There's going to be several more in November that the Office of Early Childhood is holding, bringing information about the endowment and Early Start and the parent portal, which was part of the legislation that was passed, out to the community and get feedback into how to continue making this, a more accessible system, better to understand. And then in terms of next steps, also just continuing to hear what parents and childcare providers need. We heard from United Way that in the latest data they analyzed, that more and more families are having trouble making ends meet. So that's both people trying to afford groceries, housing, childcare, which we said is a huge cost. And on the flip side, we're also talking about people in these, really vital jobs, taking care of our youngest people in the state who aren't making enough to keep up with the cost of inflation. So continuing to look at how, trends are emerging and how, the economy is changing and what can be done in terms of solutions to help people continue to thrive.
Georgia, really quickly, you got to do this briefly for me, but child care centers have to opt into this?
Yes. So it is not anything that's going to be imposed upon a child care center. So every single provider will have an opportunity to apply to an RFA, which is a request for application. We pushed this. I think they're going to move to a request for proposal for the full rollout and implementation. But right now, child care providers, just like with the Care for Kids subsidy, can make decisions to opt in. I don't think it will be a choice for many providers, because if you do not opt in as a business, if a provider down the street is a early start provider and that parent can go to that facility and pay zero, I don't see why a parent would opt to come to a center where they would have to pay between $400 to $600 a week. So the market forces are going to force everyone into this system.
Much more to find out about this particular topic. We'll be paying attention to it on the Wheelhouse. So will Michaela Savitz, state reporter at Connecticut Public State Government Reporter. You can find her work at ctpublic.org. And Georgia Goldberg, the executive director of Hope for New Haven Incorporated. She also hosts the podcast Inside Voices Community Conversations. Check that out. Did a whole breakdown of the endowment and what it means for parents. Thank you guys for your work. You've been listening to them as well. After the break, we zoom out to include as many of Connecticut's youth as we can with former Connecticut child advocate Sarah Eagan. You're listening to the Wheelhouse on Connecticut Public. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. For nearly 11 years, Sarah Eagan helmed a state agency created to protect the rights of Connecticut children. She stepped down as the state child advocate last year. She now works for a legal rights organization called the Center for Children's Advocacy, and she's speaking out on what the state can do to fix what she says are holes in the social safety net that have widened and frayed. Very important visual there. Sarah made it. Thank you for joining us today on the Wheelhouse.
Thanks for having me, Frankie.
So happy to have you on. I'm going to dig right into this. You wrote about the state's social safety net in a recent op-ed published in The Current. Give me a quick overview. Why is the safety net, as you described it, complete with holes that have widened and frayed?
Yeah, well, that's been happening for a long time. And it's part and parcel of thinking of how we support kids and families as being with a net itself, which I think is a problem, right? Because what happens to a net over time? It just gets stretched, and then things happen to it, big holes, big gaps, right? Let's look at where we are over the last 10 years for vulnerable kids, like what I wrote about in the Hartford Current. We know that Medicaid investment is not where it needs to be. We're way behind where we need to be to pay for care that kids and families need. We know that investment in our state child welfare system is down probably over $200 million a year from where it was 10 years ago. We know that supports and services for kids with disabilities in the state are egregiously underfunded, and so many families go to bed at night panicking over how they're going to get care for their kids. And we just learned that our worsening problem of what it takes to support a family in Connecticut, we have over 500,000 families in the state of Connecticut that can barely eke out a survival budget. I mean, think about how many kids that is. So in order to get well here for kids, we're going to have to be really honest about where are we in terms of supporting kids and stop thinking about it as a safety net that we can stretch over. And think about it as what is the foundation that we want to build?
Proactive, not reactive. Yeah. You wrote about someone named Teresa. Why is she representative of what's going on here in Connecticut and what's gone wrong?
Well, Teresa is one of the most vulnerable kids in our state, right? Teresa lives in state custody. She's in the foster care system. She's a real child, right? That's not her real name. She just celebrated her 10th birthday in a hospital, because she doesn't have the care she needs, she doesn't have the services she needs, she can't go home and live safely with her parents, and she doesn't have a foster home to take her. And that's terrible for Teresa, right? And what we quoted her saying, that those are her words. She turned to her lawyer, one of my teammates at the Center for Children's Advocacy, and she said, I'm afraid I'll never leave here. She's 10 years old. Right? So, but Teresa and what Teresa needs lives in the context of all the other things I just talked about, right? We need to have a system of care and support for children, not one that's crumbling, but one that we're strengthening.
Is she still in the hospital? Has there been any change since the article was written? Any kind of update in that regard?
Well, I don't want to get too specific about her situation, just because of concerns about confidentiality. But I can say that the challenges described in that article are still present for her. And they're still present for a lot of other kids. Frankie, in the last year alone, there were more than 2,000 incidents of children on Medicaid stuck in hospital emergency departments for behavioral health reasons. At any given time, there could be 30 plus children at Connecticut Children's Medical Center in the behavioral health part of their emergency department, a department built for 11 children. Why have we not solved this problem? Because we have not adequately designed, funded, and committed to a system of care for children like Teresa and other people's children and their families.
So what's the best thing that state lawmakers can do for this? Is it money over time? What should be done to help these kids?
Yeah. Well, it's not all gloom and doom because we have a lot of capacity. We have a lot of wonderful leaders. We just spent the last, 30 minutes listening to the amazing legacy of the amazing Beth Bye, right? When we design, when we commit, when we make a multi-year plan to meet children's needs, we can succeed. Connecticut has a lot of its destiny in its own hands, right? We thank goodness for federalism, but we can invest in what kids and families need, right? We have an affordable housing crisis of our own making. We have a food insecurity problem of our own making. We have an underfunded behavioral health system of our own making. We can choose to design a system of care across state agencies, from OEC to DCF to the state Medicaid agency, that says, how do we meet the needs of children and families together from birth to 21.
I think what you're getting at is kind of a new infrastructure, kind of like what Beth Bye and some stakeholders did with OEC. I think you're looking at kind of maybe a new infrastructure of sorts.
Well, we have to make sure that that kind of ingenuity and innovation is done in an integrated way across state agencies. You know, it's easy to pummel DCF for like not having enough foster homes, right? Like they're an easy target, but every bit of work they do exists in the context of every other challenge we've talked about here today, right? You can't preserve families and keep kids safe in families, be it their family of origin or a foster home, if families are struggling with basic needs and if they can't access the behavioral health services that they as adults or their children need.
Some developing news out of Waterbury. Police discovered in February a 31-year-old, 68-pound man, officers say, lit a fire to escape his home. It's alleged that he was held captive by his stepmother from the time he was 11 years old up until police found him in February, some 20 years. My colleagues in the newsroom have identified him as S. What does this case highlight about the current state of the social safety net in Connecticut, if anything?
Yes. Well, I mean, this is obviously a developing criminal investigation and prosecution, so I can't comment on the specifics of that. But what I can say is that based on the allegations, right, Connecticut remains one of a handful of states where a child can be permanently withdrawn from school and there's no follow-up, right? And I know that that's controversial for folks in the public policy realm, but the reality is just about 40 states have a specific statutory regulatory framework for governing the permanent withdrawal of a child from school, and Connecticut doesn't. And this is a matter appropriately before policymakers, and policymakers have to come up with a solution.
And that's where I kind of want to end up on here. I'm reading this directly from a May article written from Connecticut Mirror reporter Ginny Monk. I'll read it directly from here. An OCA report released Monday concluded lax homeschooling regulations, again, this is from May 5th, have meant that some Connecticut children aren't getting a proper education and the system has been used to cover up abuse, end quote. The article was published as parents of homeschooled children rallied in Hartford. This was back in May. What's your response to what Ginny outlined in her story? Is this a politically charged issue for some folks?
Well, it's been a politically charged issue for decades here in Connecticut, right? And we have struggled to reconcile, balance the rights of parents with the right of the state to ensure the safety of children and the education of students, right? No one wants to impair the rights of parents to direct the education of their children. That is a constitutionally protected right, right? The issue is actually not about homeschooling. It's about individuals who can, and we've demonstrated this in multiple state audits and reports, parents who use the guise of homeschooling and exploit the state's lack of statutory regulatory framework for withdrawing children from school in order to hide their children from public view and from state child welfare authorities. That has happened in numerous cases. That has been documented extensively by the Office of the Child Advocate, is seen in a number of DCF cases, and that's a public policy matter appropriately resolved at the legislature.
You've been listening to Sarah Eagan, the former Connecticut child advocate and current executive director of the Center for Children's Advocacy. So great to have you on the show. Thank you so much for your work. And thank you so much for your work as the child advocate.
Thank you.
Here a year on from leaving the position. Today's show was produced by Chloe Wynn. It was edited by Patrick Scahill and Robin Doyen-Aiken. Our technical producer is Dylan Reyes. A special thanks to Tess Terrible, Megan Fitzgerald, Connecticut Public's visuals team, and our operations team. Download the Wheelhouse anytime on your favorite podcast app. I'm Frankie Graziano. This is the Wheelhouse. Thank you so much for listening.